Hello, everybody. Dr. Connors again, trying to answer some of the most common questions that we get. How do we know if it's working? Okay, to do this alternative thing, how do I know if I'm getting better? What's the judgment call? What are the objective things that I'm looking for? Well, should I still do CT scans, MRIs, PET scans, X-rays? Should I still be following what my oncologist is telling me? The answer is yes. But also the correct answer is maybe. So I'm a big fan of not doing invasive tests unless it's going to change the way you treat the patient. Now, if you're still doing chemotherapy, or you're still planning surgery, or you're still doing radiation or immunotherapy, yes, you should still be following the recommendations of your oncologist. If he or she's asking you to do MRIs or CT scans to see and judge how your current therapy is working, there's a place for that. But remember, a CT scan, a regional CT scan, carries about as much rad radiation as 50 chest x-rays. It's a lot of radiation. MRIs are not void of invasiveness either. If you're using a dye like gadolinium or something like that, then there's issues with that too. So there's a place for imaging. I'm all for imaging. It gives us more defined answers. So if you had a CT scan that measured your mass at 3.6 centimeters, well, the only way to know if that's getting better is to do the same thing. You have to compare apples to apples. So it only makes sense if you want to know if that mass is improving, shrinking, or at least staying the same size, you have to do the same test that you measured it in the first place. Now there are some less invasive ways to test. You can do an ultrasound in some cases, like with breast cancer. There's tumor marker tests, which are blood tests. Maybe your doctor has already run those. You could use those as your marker, as your objective marker. Now understand, a lot of patients that come to us might be on the scale of they're still working with their oncologist. They're going to get CT scans. A lot of our patients too are like on the other side of the scale, where I don't even care anymore. I'm not going to even do any tests as long as I know I'm feeling better. And you might be somewhere in the middle. I like objective testing, but I also want to respect a person who's saying, I'm done. All I need to know is if I can jump on the tractor and plow the field and I can, live my life, then I don't even care anymore. I'm done with going down that pathway. I get that. So everybody's a little different. We can definitely order tumor marker tests if you've not had those. Those are simply blood tests. I have a blog post on that. Search the website and you can see the blog post on the different tumor marker tests. Some cancers don't show tumor markers at all. Even if it's a cancer like breast cancer or colon cancer that typically shows tumor markers, some people's cancer doesn't give off tumor markers. So we can run those. It's very non-invasive to get a blood test. Also, I tell people to measure objective tests with also subjective signs. So your signs and symptoms that you're currently experiencing. If you're feeling great, but they're telling you have stage 4 cancer, well, then you can't use this. But if you have symptoms, let's say pain or fatigue or nausea or something, you can usually tell if those symptoms start to go away and you start to feel better, you have more energy, that you can have a pretty good clue that you're doing better. Some people totally judge their cancer that way. How you decide to do that is your choice. Again, I said I like testing because I like to see objective data, but I know that a lot of testing is invasive and carries with it some level of invasiveness. So not everybody's wanting to do that. So everybody has to make their choice. We'll help you walk through that choice.